it was something worth talking about. And we know how important our brains are. We know what the brain does for us in terms of handling cognition, memory, some psycho-emotional aspects of our lives, and then also coordinating the motor and sensory system of our body. It is our brains that actually help us interpret whatever the eyes and the ears perceive. So even being in touch with our external environment has a lot to do with our brain.
And even what we feel in our body.
Exactly. So when we hold on to something, it's hot, we drop it because neurons, sensory neurons help to transmit those impulses straight through the spinal cord to the brain to interpret it. So we can find out that the brain is extremely important in learning, in consolidating memory, in retaining information, even in speech. There's a part of the brain that is involved with speech, and then there's another part of the brain that helps us to comprehend speech. So the ability to actually speak and be articulate, and also to understand what somebody is telling you, also has specific brain functions that operate that. So we need to take good care of our brains, and it's important that we know all the different conditions that can affect our brains, and what are the lifestyle or habits that we engage in that adversely affects our brain health. So
there are some people that have said the brain is synonymous with the human parts of computer. Is that true?
Well, yes, because I would even say even more sophisticated than computers, because you can imagine all the millions of neurons that you have that work day and night, and they are specialized. They know exactly what to do. They know what parts of the body they control, and that is why when somebody does have a stroke, which is a form of injury to the brain, you find out that part of the brain that is injured or is deprived of blood, there will be deficits of the body part that is controlled by that area. So you find out there is weakness, there is actually maybe paralysis or loss of sensation and all that. And it's very important for us to realize that just like our health in general, there are little things that we do every day, little habits that we can inculcate that can actually improve our brain function. And there are many conditions, of course, that affect the brain. You can think of simple things like infections of the brain and central nervous system, like meningitis. We heard recently, like some months ago, there was an outbreak of meningitis somewhere in Nigeria, and that's inflammation or infection of the covering of the brain, of the meninges of the brain, and it can easily transmit into a proper brain infection. It can also affect the brain. Then you can also have encephalitis, which is an inflammation of the brain also, which could be due to a viral infection, particularly in immunocompromised people that have a reduced immune system function. Then, of course, you could have diseases of the brain also, like seizure disorders, epilepsy, that can also be from abnormal electrical activities in the brain, where you find out that the person may lose consciousness, or the person becomes stiff or jerks or has uncontrolled spasms and all that. All that can also be pointing to a brain issue. Then talking randomly on other things that can affect our brains, even a stroke is a form of brain injury. When you have uncontrolled hypertension, uncontrolled diabetes, or high cholesterol that you are not managing well, you can actually come down with a stroke, which is a form of brain injury as well. And it is an emergency, because when you intervene early, the outcomes are usually better. So we usually tell people that once you notice you're speaking with someone and suddenly you notice that maybe there's facial asymmetry, like one half of the face is drooping compared to the other side, or you notice there's slurred speech, or you notice the person is saying there's weakness of one limb or both limbs of one side, then you should know it's an emergency and rush the person to a health facility.
Now, before we continue, you can ask your questions while the doctor is still here. There's a WhatsApp number. Just WhatsApp, please. 081. Just send us your message via WhatsApp. 081 717 56338. Again, 081 717 56338. 1138. Send us your questions on WhatsApp, and of course, Dr. Charles will be here to answer the question. What other avenue can they send messages to you?
So on Facebook, they can go to 24/7 DOCS, so 24/7 docs on Facebook. You can drop your comments, drop your questions, or whatever you have in mind to ask, and the doctors there will be glad to respond to.
Okay, well, continue.
So, of course, talking about other things that can affect the brain, we can also see that even little habits like too much alcohol can affect the brain. So, alcohol has been shown to sap up our important vitamins, particularly thiamine, vitamin B1. And then it has also been shown that people can also have some nerve-related damage from too much of alcoholism. And alcohol, when you lose your vitamin B1, you start having some form of encephalopathy. It's a big name just to say there's a problem with the brain. And when that happens, you find out that the person may start having loss of coordination, loss of balancing, and then the person is in a confused state, and that is also an emergency. And you can also find out that the brain is so important, because even from birth, when a child is born, the moment a child comes out and takes his first breath, it's very important that the child breathes well, properly, and proper resuscitation is done at birth to ensure that the lungs expand and child takes in oxygen. For babies that are born and they have what we call birth asphyxia or delayed breathing, maybe they had some secretions that they swallowed, or something is causing them not to breathe properly, or they have respiratory insufficiency at birth, you'll find out that because the brain is deprived of oxygen for a while, they can have irreversible brain damage. And that is what leads to cerebral palsy, whereby a child is not the same. The child is never the same in terms of developmental milestones, in terms of intellect, in terms of learning abilities, and the child will need to go to a school for special children and all that. And that's just, that's a different trajectory for that child. So it's very essential that we take good care of our brain health. And one of the simple things we can start with are your nutrition and sleep, quality sleep. Because
as simple as that will go a long way,
a big way. So you're eating right, you're intentional about what you eat. In a place like Lagos, we eat what we find, because you're out of your house so early, and you can't make a proper meal, and whatever you just grab, you just eat, be it a gala or plantain chips.
The hustling capital of Africa.
Yes. If not the world.
If not the world, exactly.
Yeah, everybody is on the move, everything is fast paced, so you try to grab whatever you want to eat, and you're doing that constantly every day, week in, week out, and you are losing important nutrients. Your nutrition is not what it's supposed to be, and because you're not being intentional about your health, your body figures out these deficiencies, and it plays out in different ways. So you can imagine somebody who has been deprived of proper nourishment, and over time is probably drinking alcohol after work, and probably is not resting well because he lives far away and he wakes up early in the morning. So the person's brain health is already nosediving
on the downward spiral.
Exactly. So you find out that people that don't pay attention to their nutrition and not getting enough sleep may have a risk of certain health conditions. We all hear of dementia, we all hear of memory loss and cognitive impairments that comes with age. But now we're seeing it that it doesn't necessarily have to happen to somebody who is 80 or 90 again. Even younger people are beginning to come down with these things, because when you sleep, when you have a proper refreshing restorative sleep, your brain detoxifies itself at that time. So the toxins and the amyloid plaques and those things that get deposited in your brain when you have dementia, they get cleared out, when you have a restorative sleep. But how many people actually get sleep? We don't sleep enough. Sleep is underrated, but it is one natural thing that we must follow if we really want our brains to serve us for long. And whatever we learn, especially for people who are still in the academics or people who learning is still very important too, they must ensure that they get good refreshing sleep, because whatever you learn or whatever you you are taught, it is during your restorative sleep that all these memories getting consolidated and become a part of you, and proper assimilation is attained. But for people who rarely sleep well, your focus and concentration is also impaired, so you are not at your best, and your mind cannot be as creative as it should be, and you are not able to retain information like you should. So it's very important that once you are noticing sleep impairment, or you notice that there's a decline in the quality of your sleep, or you sleep and you wake up not feeling refreshed, you should go see your health practitioner. Because a number of factors may be responsible. It could be anxiety, it could be depression, it could just be chronic stress. Whatever it is, your doctor will figure it out and help you to start getting proper sleep, because that alone can reverse many things and reduce your risk of Alzheimer's, dementia, of even some cancers, and unnecessary immune system impairment. Because if you are not well rested, your stress hormones will be high and your body will be vulnerable to infections, and you're likely going to fall ill very easily.
Now, the World Brain Day, as I said, was yesterday, July 22, annually, was established by the World Federation of Neurology to raise awareness in the soaring rates of neurological disorders. What do you think is responsible for these high rates of neurological disorders?
I think first and foremost is about awareness, creating more awareness, especially in third world countries. The ability to do research and have statistical data for illnesses and the onset of illnesses is very paramount to any community or society, because it helps you know what are the trends, what are the new things happening, what are the new spiking problems that you're having in the health system. But if you don't have proper data for all that, you'll just be missing those numbers, and you won't know that something is already eating deep into your society, and you have no clue until it has already eaten far too deep before you realize what to do. And for some of these cases, once the process has started, it is difficult for you to halt it. You can only just try to slow down the progression. It's already there, like Alzheimer's, dementia, for instance. It's a progressive neurodegenerative disorder. So once it starts, the process has begun. You can only slow it down. You can't really stop it completely. So it's very essential that people know that westernized diet or unhealthy eating is also a culprit. Just eating
contribute to the rising cases of neurological disorders.
Yes, westernized diet, taking all sorts of artificial foods, processed foods, junk foods, unhealthy fats. Foods. Yes, fast foods in general. All these kind of things. They affect us adversely. And then also we've also realized that nowadays, due to developments in technology and diagnostics, some illnesses that were not understood previously, there's better knowledge of them now. Some autoimmune diseases also, whereby your immune system mistakenly attacks your normal body cells, like in multiple sclerosis, whereby you find out that the neurons are attacked, the nerves are attacked, and then you now find out that the person has a lot of neurological deficits showing up. If there were no proper diagnostic facilities for that, people would not understand why somebody would just probably become paralyzed, or a person will suddenly lose their vision, or a person will suddenly have loss of bladder control and all that, or have speech problems. But now we're beginning to see that with the presence of better diagnostic equipment and tools, we're able to quickly diagnose these things, or even identify people who are at risk of these things. And I think, again, in this part of the world, we do not pay attention enough to family history. I think that's a key thing, because people that are directly related to you that have any serious illness, you should know what illness they truly have, so that you'll be on the lookout for it, because you share genetic material with them. And genetics, very strong. Genes don't lie at all. If something runs in your family line, there's a very high likelihood you're going to have it, unless you take drastic steps. And the drastic steps will be to change your diet, change your lifestyle, maintain a healthy weight, go for regular wellness checks, and pick things up early when they first show up. But if you don't have a clue what is happening to people, of the generation ahead of you, you would really run into a lot of troubles you don't expect. They just come out of the blues, and it will only make sense after it has happened that, oh, I had an uncle that had this, or I had a brother that had this, and now I didn't understand what it was then, but now that it's happening to me, I know what it is. You don't really have to tell that part if you follow the trend of family history to notice what conditions are prevalent in your family, and then you start screening early for it and making sure you are making amends to your lifestyle.
Okay, you can still send in your messages, questions to our doctor. The WhatsApp number is 081-717-56338. Again, 081-717-56338. Send in your questions via WhatsApp while he's here to answer them. Now, you mentioned one or two neurological disorders, the partial stroke, and what are the other common neurological disorder, and how do we see the signs for us to go to doctor for early diagnosis?
Okay, just like I mentioned a few earlier, some of the neurological problems that you can have viral encephalitis, you can have meningitis that can get complicated and give you neurological signs.
Meningitis, I thought meningitis is a STD.
No, it's not an STD. It is infection of the meninges, the covering of the brain.
Okay.
So once that happens, you can actually have, the infection spread to the brain and give you some neurological signs. And then also you could have seizure disorders, like I mentioned, including epilepsy. You have the simple seizures, you have the complex seizures, you have the absent seizures, all different kinds of seizures. You can have brain trauma, even from just accidents. A person can have a fall, a person can have a head impact, and it can lead to damage to the brain. And we've also noticed that there is something called post-traumatic epilepsy. So a person can have head injury, and many years later he comes down with epilepsy that he didn't have before. That is like a sequelae to that trauma that he had previously. And some people may actually bleed into the brain directly, if they have a contusion. So there's a concussion and a contusion. Those are types of brain injuries that you can have, whereby you can have some form of impact or shift in the brain, and it can either result in obvious bleeding that you see on imaging, or there may not be bleeding but you still see some signs on the person. So what are the main signs to look out for when a person has neurological issues? Some of the red flag signs could be a persistent headache, it could be nausea and vomiting, it could be loss of vision or blurry vision in one or both eyes. It could also be transient loss of consciousness. The person just loses consciousness and there's no reason for it, Or you can also find out that the person has weakness or complete paralysis of a part of the body, or loss of sensation or perception. And there are different types of loss of stimulus a person can have. A person can lose their sense of pain, sense of temperature feeling, sense of vibration, sense of position. They can actually lose those things depending on what kind of neurological problems they have. And because nerves run all over our body system, if there's significant nerve impairment, it could also affect bladder control, it could also affect bowel motion control, all those sphincters connected to nerve, or they're under nerve control. So if you have a major neurological problem, all these things can also be hindered and cause complication for the individual. So it's very important that anyone that has a headache that will not go away, a headache that is persistent, a headache that you've slept and it's still there, a headache that you've taken regular analgesics and it's not improving, please do not trivialize it. Go get it checked. You may need a brain imaging. It could be a major lifesaver. And some other people may have cancer from one part of the body which gets disseminated to the brain in some instances, because cancer can move through the bloodstream and through the lymphatics. So if it gets to the brain, the person can also present with things like raised intracranial pressure, headaches that would not go away, vomiting, And pressure symptoms, wherever that tumor is located, it can compress on any nerve or compress on some structures, and that would determine what kind of effect it will have on the person. So it's very important that we don't leave anything to chance, because a lot of people have actually saved their relatives, I know, because they were able to pick the signs up early and they were able to seek intervention early. But when you say, oh, let's give it another day or two, or it's Monday and you say, let's wait till Friday, it's not always like that. You don't always have the luxury of that time.
What about mental illnesses or disorders or diseases? Are they associated with the brain too?
Yes, to a very large extent. A lot of people would ask, where actually is the mind located? Is it in your brain or in your heart? But you have some parts of your brain that control your thought processes, your decision making capacity, your memory, your emotions. So it's more in the brain. And then you find out that when people have mental illnesses, for most psychosis, you do a brain imaging and you're not going to see anything. Everything is going to look normal. So it's not going to be that something is happening in one part of the brain. That's why the person has a mental health illness. But the truth of the matter is, when it comes to mental health, it goes way beyond structure or what you see. That's why the human mind is very complicated. The human mind is very vast. A person can have a normal brain imaging, but his perception of life is completely different. His own delusion that he has, because you have your will, you have your emotions, you have your belief system and all that, and that has nothing to do with what the structures of your brain look like. So that's part of you, that's an intrinsic property of that individual. So if the individual is deluded, for instance, or has some form of perceptual disorder, he can be hearing what others are not hearing. He can be seeing what others are not seeing, that we call hallucinations. He can be feeling all your five senses. You can hallucinate with the five senses.
Or personality disorders.
Exactly, where people either are narcissistic, or they have OCD, or they have avoidant behavior, or they are schizoid. All those things, they come from the personality, and it comes from the way the person perceives their environment, the way they relate with their environment, and the way they interact with people around them. So basically, mental health illness, transcends normal neurology of just looking at the brain and the central nervous system.
In other words, it's way more complex than that.
Because there are many things that have to do with your mind that it's not even visible, but it's real. Very real, and it determines how you see life, it determines how you perceive life, it determines what you hold dear, what your beliefs are. And for some people that have strong delusion, there is nothing, even with all the facts, they remain deluded and they can't be in tune with reality.
What the cause of prostrate or frequently urinating at night, rather? Also, I see friend and advise me to go and see urologist specialist. Please, doctor, which way? Sir Usaini from Ayobo is talking about causes of prostrate and frequent urinating, mainly at night.
So frequent urinating at night for most men, after the age of 40, it is advised that they do their prostate screenings. There's a normal age-related prostate enlargement that happens, but the degree of enlargement may vary. But ultimately, what the enlargement does, it causes obstructive symptoms and obstructs the outlet of the bladder, so your bladder does not empty one time. So if you go to the bathroom to pee, you notice that you feel the urge to pee, but you notice the stream of your urine, the pressure of the urine is not the same. It has slowed down, and you may notice that the urine may even be trickling, and then it comes out, stops a bit, then starts again. Just because,
despite the severity of the fact that
you feel the urgency, yes. And then after you return, when you think that okay, you've actually passed out urine, because everything is not emptying at once, you still have retention. So after a while again, you feel the urge to go again. So that's how the cycle goes on, because you are not emptying it all at once like you used to do when you were younger. Sometimes, of course, when you were younger, you could just pee at once and you may not need to pee until a very long time. But in this case, because of the poor urinary stream, because of the poor flow of urine and the degree of obstruction of the outlet of the bladder by the enlarged prostate, you may need to be on certain medications that helps to reduce or to reduce the pressure in the bladder neck, to relax that muscle there so that you can empty your bladder, and then possibly to have something to shrink the prostate. So but before you do anything, that is for your urologist to decide what to do for you. So what you need to do is get a PSA done, it's a blood test, get a prostate scan done to assess the size of your prostate, and then your urologist will now decide what is best for you. But not every prostate case is just prostate enlargement. There are 3 conditions that can affect the prostate. It could be prostatitis, which is inflammation or infection of the prostate and can give you urinary symptoms as well, and it could be normal enlargement that comes with age that we talked about, and it could be prostate cancer. So that means you can't just leave it to chance. You need to be sure what you're dealing with and then take the right steps.
Okay, we have another question. I always have waist pain and my 2 legs pains me too. What can I do?
The first thing you must do is to find out why you're having the low back pain. First, it could be age related, because you can have some spinal degenerative conditions, and then you could also have some muscular strains and muscle spasms there. But the best way to be sure is for you to go for an imaging of your lower back. Have an imaging like an x-ray done, and once you've done the x-ray, from the finding of the x-ray, we're going to know if you would need to go for a more detailed imaging like an MRI, and then you may need to see your orthopedic doctor, because you can have some of your disc shifting or prolapsing or impinging on a nerve, compressing on a nerve, which would ultimately give you some radiated discomfort into your lower limbs. So it's good for you to do this imaging and see an orthopedic doctor for a review. And if you need to do an MRI, the better, because that would clearly show you the soft tissues, the bones, the nerves and everything, and know if there's any compression anywhere. And ultimately, physiotherapy may also be helpful.
Okay, good morning, doctors. If a doctor recommends a 50 mg of a drug and they have 100 mg in the clinic, and split them into 2 for you to take one to get the 50 mg, do you think they are evenly split? And if not, are you going to get the required result when taken, Madam Florence? You understand the question?
Yes,
right?
correct.
Okay.
Well, in some cases we find out that
we also have situation where the drug is maybe 100 mg, but we don't have to mix 250 mg together to get
100 mg. Well, the truth is that the most pharmaceutical companies, they've done their due diligence before they label any particular drug of a particular strength, so they know that is what it is. So in the absence of you having to break 100 mg into 2 to get 50 mg, it's better than you not taking anything at all. It's better than you not taking anything at all. So in the name of I'm waiting for 50 mg and I'm not taking my drug and my BP is now going up and I'm getting things complicated, if that is what you have at hand, in this case, half bread is better than none. So
you can as well take the 100 mg even though the 50 mg was the doctor's recommendation.
So if you can split it, yes, rather than you not using anything at all.
No, but that's what he's asking. They say if a doctor recommends a 50 mg drug, but when you go to the pharmacy, the drug they have is 100.
That you have to split.
Can you split it into 2 and take one? And that okay?
You can still do that. You can still do that. It's better than you not taking anything, not taking your drugs at all. But you just make sure that in the process of doing it, you don't get things contaminated, because the way you split and what you used to split and all that too matters a lot.
And the other way around too is the same thing. Maybe doctor recommended a 50 mg, but the pharmacy only had 25 mg. Instead of one of that 50 mg, you can take 2 tablets of that 25
yes
mg.
to make up your dose.
That works too. Okay, there's still time for you to ask your questions via WhatsApp 081-717-56338. Again, 081-717-56338. WhatsApp, please, not SMS. Ask your questions while the doctor is here. Now, I mentioned you mentioned sleep, and these seem to be a recurring discussions among medical practitioners. There's this recent campaign about sleep. But in a situation where we get contradictory messages, from some other few, will I say, descending doctors or public analysts and motivational speakers, where the advocation is totally different. Don't sleep too much. There's a lot
productive.
Exactly. There's a lot for you to do. By the time you sleep 7-8 hours a day,
You slept 20 years of your life and all that.
Exactly. So we get this contradictory message. So how many hours of sleep do you recommend?
Normally, you should get between 7 and 9 hours of sleep as an adult.
7 and 9
as an adult.
That is a long time to sleep.
For you to get refreshed, for you to get rejuvenated, for your muscles to be released of the stress of the previous day.
And you recommend that every single night.
It is supposed to be that way.
Now, this is where another confusion comes in. Now, I've talked to a couple of medical practitioners, and there seem to be two different school of thought as to how the sleeping pattern will be. I remember I've talked to you once about it too, where we talked about the 7 to 9 hours. Does that include the siesta or afternoon sleep? Like if you find yourself in a situation where you have a less productive afternoon and you want to sleep, does the 7 to 8 hours or 7 to 9 hours go in a 24-hour span, in the sense that you can sleep 2 hours in the afternoon and 6 hours at night, and that is okay? I've heard some doctors say yes, that is okay. I've also heard some medical practitioners say no, even if you sleep 1 or 2 hours in the afternoon, the 7 to 8 hours night sleep is sacrosanct. It does not matter whether you slept the whole day in the afternoon. So it's like two different school of thought.
Well, the truth of the matter is that if we want to analyze sleep properly, we need to understand the concept of sleep, what puts us to sleep, and how the sleep cycle goes. So normally the melatonin hormone produced by the pineal gland, starts rising in the evening and puts you to sleep. Cortisol wakes you up in the morning and peaks around 8 a.m. in the morning. So basically, you need to sleep more between 10 p.m. and 4 a.m.
Okay.
You need to sleep around that time deeply. And that is the time some people are just getting home. That's when people are just getting home. For some people, that's when some people are still on their laptops trying to finish up what they started during the day, or that's the time some people say they are most productive.
And that's also the time where movies and TV series are very, very interesting to watch.
Exactly. But the truth of the matter is that time is when your body requires the most rest. So we get it all wrong if we think we can sleep during the day and stay awake at night, because that's not in tune with the normal circadian rhythm. It's not in tune with the normal natural sleep cycle. The night was prepared for sleep and the day was for activities, and that is why your cortisol is more, it prepares you for the activities of the day, because it knows that and that's why it's called the stress hormone. It's expecting that you have stress during the day. So but for a lot of people, the reverse is the case. They'll say, I have slept in the afternoon so that I can stay awake at night. Mind you, research has shown, it's a documented fact, that health workers and people that do night shifts, they have chronic sleep problems because they have completely altered their natural sleep cycle. So when others are sleeping, they are wide awake. When others are wide awake, they are trying to sleep. And because melatonin does not rise during the day naturally, you understand, you are going to be messing up many things for yourself. And also, it's been noted also that a lot of people, because of some of the substances they take habitually, it could also impair their sleep. Caffeine, energy drinks, and so not to talk of some recreational drugs that people abuse that alter a lot of things in how their body functions, ultimately affects the quality of sleep that people get. And it's been shown that if you don't sleep well, your stress hormone levels will remain high for a very long time, and this causes inflammation, cause some onset of illnesses like hypertension, even diabetes, even weight gain in some people. And then ultimately some people can start having mental health issues. You'll find out that a lot of people, a high proportion of people that deal with mental health issues have sleep problems.
Wow.
Or it's actually started from having sleep problems. And I'm actually seeing a trend in dementia patients too, that before the full diagnosis of dementia, was established, they've had years of chronic insomnia. So it's very necessary that if you're not sleeping well, you don't trivialize it and you don't normalize it and you don't say you are strong or it has always worked for you.
What about someone like me? I've discussed this with a different doctor right here on air. I have this situation where I'm a very light sleeper. First of all, I find it difficult to sleep. Some people, once they hit their head in the pillow, 5 minutes they're gone. Me, I struggle for 1 or 2 hours before the sleep finally comes. And then in the morning, where people are waking up around at 3, 4, it's like that's when my own sleep is starting. That's why I've never been a morning person, and thank God for a while I've not had a job where I have to wake up by 4 or 5 a.m., which means I have to sleep till like 6, 7 before I wake up. But that's one. Then the other, very light. I wake up at the slightest of sound. The slightest of sound or movement, the slightest. A neighbor opens his door and I'm up. A neighbor and is quarreling, I'm up. A baby crying, I'm up. As in the slightest of sound, I am up.
Well, I think sometimes some people are just a bit hyper vigilant. Let's use that word.
Yeah.
So they are just very aware of their surroundings.
Well, I grew up in the barracks, so that shoe, hyper vigilance is one of our things.
Yeah. So hyper vigilance and certain habits too, over time can also inform that. And for some other people, I've noticed the trend of people who say that happens to them. It could be because they have PTSD too, post-traumatic stress disorder. It could be because they had an experience before and they cannot really be fully rested because their subconscious is always slightly awake, like this thing should never happen again. God forbid somebody that's experienced an armed robbery attack or a kidnapping or an assault or whatever, something that's really traumatized them. So for them to actually be relaxed and sleep soundly, they have to heal.
A miracle.
Yeah, they have to heal from that trauma, because once that trauma is there, your mind always flashes back, and there's always generalization. If you're somewhere, maybe it was a blue car that kidnapped the person before, when he sees any blue car, he will just realize it's this kind of car. You understand?
It'll be a trigger.
It could be a trigger. And then anxiety, a lot of people are concerned about uncertainties, where the bills will be paid, deadlines, exams, and all that. All those things too can keep people, as light sleepers, because your mind is functioning, around the clock. You are planning, but your body needs sleep, but your brain would not just stop, conceiving ideas and processing things. So basically, a number of factors are responsible for that. So that's why it's always best to seek professional help when you now see that it's not affecting your normal functionality and it's not letting you carry out your daily routines appropriately. But I think as a people, we're still not very open to seeking professional help on time, because we always think, we'll figure it out. No, it has happened to me before. Somebody else who is not a professional will be reassuring you for what is really an emergency. We see that happen all the time. But it's better when it comes to your health that I don't want to use the word becoming an alarmist, but raise the alarm. See your doctor. Let the doctor by himself examine you and tell you there's nothing to worry about, than for you to assume there's nothing and there is a big issue.
Okay. Please send the doctor's name and number to me privately. Conversely, give him mine to establish a link. Okay. I just stormed on the topic. I must have missed out on that. Okay. OC from Shasha. He wants to talk to you privately.
Can he leave his number?
Okay, so Nwaje from Shasha, please leave your number and for the doctor to get in touch with you, or better still, the Facebook.
The Facebook, yes, 24/7 DOCS on Facebook. You can send a chat there, and then you can put your name and your number, or you could also drop your number here, and we'll reach out to you.
Okay, thank you. Let's see. Good morning, Doc. I sleep only to wake up wide in the middle of the night, no matter when I retire to sleep. Why this? Tony from IBA web news site.
Well,
I mean, it's basically what we just talked about.
Yes, so
where,
it could just be
a situation where you slept after 1 hour, something wakes you up and you can't go back to bed.
Or it could be that you've actually had that routine for a bit, but now your body is now used to it. Like we doctors, when we do night shifts, when you're on the night shift, you're expected to stay awake because emergencies can come and all that. But you now find out that when you're not even on the night shift at home, it's hard for you to tell your body you're at home now, you're not at the night shift.
Muscle memory.
Exactly. So you're still in that alert mode that you can be woken up at any time, or you could be called for any time. And around that time that you normally have patients, you will find out that you will be awake even when you're at home. So that happens. So we human beings, our minds get conditioned very easily to routines. So unless you actively work on changing that, it may be like that for a while.
My question is, what is the cause of someone's mouth or lips shift to one side and the person is not talking like the way he's talking before, and still the person was admitted in the hospital and still it's still the same? Ikechukwu Austin from Orilowe Ejigbo.
Please, that person has slurred speech from what you're describing, and there's deviation of the mouth to one side. It could be one of these things we're talking about. It could be a neurological issue, most likely. We want to do a thorough investigation for this person. You want to find out if this person is hypertensive or diabetic or have high cholesterol. Could it be Bell's palsy in some instances, or could it be a major stroke incident, especially when there's weakness of the limbs associated? So the patient needs to be reviewed by a neurologist immediately. It's an emergency. Let the patient, especially when speech is now affected, please let the patient be reviewed by a neurologist, do the relevant brain imaging, and do some baseline investigations as well. And start physiotherapy early so that you can reverse.
Okay. Please, that doctor. Okay, Ikemba from Mafoloko Shodi. Okay, also send this number. That means you have two numbers.
Okay, no problem.
And I've been having frequent urination at night, and during the day I have gone to the hospital for tests. My blood sugar is fine. My PSA test is 9.69 ng/ml. I am free from UTI infections. I don't know if it is overactive bladder. How do I stop the frequent urination? John from Mile 2.
Your PSA is 9.69, you said?
1.69.
Oh, 1.69. Okay, that's fine. 1.69 is fine. 0 to 4 is the normal range. Okay, so what you need to do is, since you've screened out diabetes and you've
PSA
test is normal. I don't know if you did a urine culture for you to find out that you do not have a urine infection. But if you have,
also say I'm free from UTI infections.
Okay, so that means you probably have done a culture. So if you've done a culture and it's fine, then we'll probably think of what you're thinking. Maybe it's an overactive bladder indeed that you have. And then I would also want to ask, do you ever have any urgency that you want to use the bathroom and you need to go immediately, otherwise you pee on yourself? All those things, or incontinence, all those things help us to actually know indeed what you're dealing with. There are medications to help with overactive bladder if that's the case. So you would need to see a urologist to also examine your bladder and assess your bladder control. So that will help us know whether you really do have a neurogenic bladder or an overactive bladder.
Well, that's the much we can take. Dr. Charles, thank you very much for your time. It was a pleasure talking to you.
Same here.
Thank you. Okay. Okay, that's it on the brunch on the Voice of the People 90.3 FM. Inyangul will be back tomorrow to take you on the show. I am Solomon of Good morning and thank you for listening.